Well, women are also facing a critical gap in healthcare and being underdiagnosed for certain conditions compared to men. Now, this includes disproportionate impact of autoimmune diseases in women. Joining me live to talk more about it is autoimmune researcher Sara Hirsh Bordo. Good morning to you. Thank you so much for joining us.
Oh, good morning, Brittany. Thank you so much for the opportunity to share.
It's just a very important topic right now and something that so many can relate to. And I want to get to a new survey, and it shows that 1 in 4 American women grapple with autoimmune diseases. And so I was hoping you could walk us through some of the other major findings in this research.
Yeah, absolutely. As a documentarian and as a autoimmune diagnosed woman myself for almost 17 years, I started asking questions around the women that were being diagnosed around me, trying to understand and piece the puzzle, because out of 100 plus autoimmune diseases, 80% of those diagnoses are being received by a woman. And out of all of those diseases, not a single one has a cure yet. So as it related to the kinds of questions that I wanted to ask, I started asking questions anecdotally within my community, as well as putting out sort of small group surveys. Basically, what I found over and over again there were incredible patterns between disempowerment and women with autoimmune conditions. And one of those key findings that I want to share is that more than half of women that we researched identified as a caretaker when they were a girl. And beyond that, what we found is what that kind of conditioning as a child to sometimes not invited to share their own needs, sometimes not invited to share their own wants. And that conditioning has made it hard for women now being diagnosed and in a position where they need to be fighting for their own health. 95% of our 1,000 women across our national survey said that they would rather caretake or give than receive. Another key data point, Brittany, was that nearly half of our 1,000 women say that they quiet their voice in a doctor's office so they don't disappoint them.
Sara, that's really powerful, staggering information there, especially when you reference the fact that there's so many women are taking care of everyone else and not paying attention to their needs necessarily. We know another challenge that can come with autoimmune diseases is the fact that some of these symptoms, they're not necessarily visible. It isn't always obvious. How can this really affect women and getting diagnosed properly?
Well, for me, and I can just speak for myself, it took me about 2 years. I have other friends with rheumatoid arthritis or multiple sclerosis or fibromyalgia or psoriatic arthritis that has taken 3 and 4 and 5 years. It's expensive to go to the doctor. It's expensive to keep going to the doctor to get an answer. And what our data shared is that we need to embolden, very similar than your esteemed judge who was just on, about speaking up. So my goal with funding this research myself was that I can help foster a little bit more permission within women to use their voice, because we need them to fight for their own well-being.
Now, Sara, I think this is something that kind of resonates with everyone. I know I too, sometimes when you go to the doctor, you can feel anxious, you can feel nervous. You know you have to advocate for yourself, but that can be really difficult. What would you say to someone who worries, maybe I'm overreacting about my health? What would you tell them?
Well, I would tell them that you have intuition for a reason. Your body has a language, and your body is always telling a story. And that comes from a storyteller's point of view. But what we saw over and over and over again is that permission to express a need, to keep expressing it until you are heard. And sometimes it takes getting a bit clumsy with our voices before they get clear. And I just encourage all women with diagnosed or loved ones to download the survey, the findings I've made for free on autoimmunesurvey.com.
I like that, the clumsy before it's clear, but so important to advocate for ourselves. Sara Hirsh Bordo, thank you so much for your time and for joining us this morning.
Thank you so much.